Hello everybody, my name is Nigat Saeed. I am an FNP student at Franklin University, and today I'm presenting mental health needs in special population. Let's talk about what is the definition of mental health. Is Mental health is our emotional, psychological, and social well-being, and it's our ability to think, feel, relate to others, function, and make choices in life. So what do you think is mental illness? Mental disorders are health conditions that are characterized by changes in thinking, moods, behaviors, and a combination of all. They are usually associated with distress or impaired functioning. Mental illness in older adults. About 18.7% of age 65 to 74 and 23.5% of age 85 and older have mental illness in United States. According to DSM-5 revision, mental illness in older adults include depression, bipolar disorder, anxiety, obsessive compulsive or hoarding disorder, suicidal behavior disorder, schizophrenia with psychotic disorders, trauma stress-related disorders, neurocognitive disorders that includes delirium and dementia. Healthcare cost for the total Medicare spending for older adults on mental health care services is about 4.2%, with an addition of 8.5% to medical spending, which is associated with mental illness. Assessment and screening for depression according to DSM-5 criteria for older adults include symptoms that we need to pay attention to. Those are some of the symptoms that include lack of interest or pleasure in the activities that they used to do before, loss of appetite and weight changes significantly, worthlessness or guilt, problems with their memory, and thoughts of suicide. Screening is usually done by a geriatric depression scale, and that scale is for 5 minutes, which is easier for older adults to answer the questionnaires. Score of greater than 5 suggests depression. Older adults with depression have more agitation and somatic symptoms. Some of the diagnostic tests in the PCP clinic would be to do CBC, CMP, TSH, urine analysis, serum B12, folate, calcium, vitamin D, syphilis serology, and ECG for differential diagnosis. The treatment includes pharmacological and non-pharmacological interventions with physiotherapy, which is effective in treatment for older adults. Medications include SSRIs and SNRIs, which are preferred. Others may include TCA and MAOs, but they can cause cardiac and anticholinergic side effects in older adults, and they really need to be monitored. Once the therapy is started, we have to continue medications for 6 months to prevent any relapse. Psychotherapy include also have with it exercise and ECT, which is electroconvulsive therapy, if they do not respond to other treatments. As a PCP or nurse practitioner, we have to collaborate the care with psychiatrists and psychologists for optimal health outcomes. Bipolar disorder is another mental health condition among elderly population. Before treatment, we have to evaluate for motor activity, pressured speech, and racing thoughts to prevent any occurrence of mania. Treatment include lithium, carbamazepine, lamotrigine, atypical antipsychotics, and antidepressants. ECT, which is electroconvulsive therapy, and psychotherapy is utilized when treatment is not working with other medications. Anxiety disorder is another common mental health problem with 15% of occurrence among elderly. Treatment includes SSRIs. It's the first choice for this population. CBT is safe and effective also. Suicide is has the highest rate of occurrence in elderly population, especially if they have depression and it is left untreated or undiagnosed. More than 58% will contact their primary care practitioners within 1 month of completing suicide. And PCP should identify and treat older adults with thoughts of suicide. Late onset schizophrenia among elderly is treated with antipsychotic medications. One of the major complications that clinician needs to be aware of is extrapyramidal syndrome. Patients should also be monitored clinically and with lab testing like CBC, CMP, lipid profile, and BMI. Clinicians should encourage patients to remain compliant with medications and psychotherapy to prevent any relapse. The two other most important conditions among elderly that needs to be recognized are delirium and dementia. Delirium is acute in onset with altered mental status and variable in signs and symptoms for a short period of time. Usually infection, dehydration, and medications are the common causes for delirium. Screening tools includes MMSE, and the labs would include CBC, CMP, TSH, UA, urine for toxicology. The treatment mostly focuses on improving sensory deprivation, prevention of any illnesses, and decreasing the number of medication among elderly population. Dementia, on the other hand, is slow and insidious in onset, cognitive decline with memory problems. Screening tools, MOCA, SLUMS, and MMSE. Treatment, non-pharmacological, behavior management, cognition stimulation, reorientation therapy, recreational activities. Pharmacological interventions include cholinesterase inhibitors, antidepressants, and antipsychotics. Patient and caregiver education for mental health issues and community resources should be provided for improving functional independence. And then follow-ups and referrals to psychiatrists, psychologists, and neurologists is highly recommended. Another important mental health issue that I will be discussing today includes perinatal and lactational period in a woman, as we know, 1 in every 7 to 10 pregnant women and every 5 to 8 postpartum women develop a depressive disorder. Mean rate of depression during perinatal period is about 11.5%. On assessment, perinatal depression lasts more than 14 days. A personal and a family history of depression needs to be collected from the patient. It could be due to unwanted pregnancy, multiple birth, health problems, physical or sexual abuse, substance use disorder, lack of social support. The symptoms include sadness, depressed mood and energy, sometimes weepiness, impaired appetite, excessive sleep or insomnia, worthlessness, anxiety, constant worrying, and especially no attachment or interest in the baby. Screening by PCP, we can use the PHQ-9 screening tool for depression and screening for IPV for pregnant women, which is very important. Postpartum mothers should get screened in 6 weeks visits and then again after the final postpartum visit. Treatment includes psychotherapy, support group, and sometimes antidepressants. Referral to reproductive psychiatrist is highly recommended. In this slide, I am presenting perinatal anxiety. According to DSM-5 criteria, as you see, for perinatal anxiety, symptoms should be restlessness, fatigue, difficulty concentrating, irritability in the mood, muscle tightness, sleep disturbances for at least a minimum of 6 months. The tool for screening is Hamilton scale. The treatment plan includes non-pharmacological interventions such as CBT, relaxation therapy, massage therapy, antidepressants, SSRIs and SNRIs, and anxiolytics may also be considered carefully. Interdisciplinary collaborative care should be established between general nurse practitioner, psychiatrist, psychologist, obstetrician, or midwives. My next slide shows mental health disorder during breastfeeding. Assessment by the primary care practitioner should include substance use disorder, anxiety and PTSD, and depression. Labs would include CBC, CMP, TSH, STD, and urine for toxicology. Treatment is focused on encouraging the mother to breastfeed her baby, and some clinicians also recommend pumping and discarding breast milk when the drug they use for mental health disorders is at its peak level. And clinicians should really weigh the risks to the mother against the risk of infants which exposed to the psychotropic drugs or to a depressed mother. But at all time, breastfeeding should be encouraged and truly supported by the clinician. My next slide is about mental health disorders in pediatric and adolescent population. About 1 in 6 US children between age 6 and 17, they have a treatable mental health disorder such as depression, anxiety, and ADHD. Nearly half of these children with these disorders, they received no counseling or treatment from a mental health professional. There's a significant role of primary care practitioner in early diagnosis and treatment and referral to these children with mental health problems. ADHD is one of the form of mental health illness which we have to assess as a primary care provider with children who present with academic or behavioral problems, symptoms of inattention, hyperactivity, or impulsivity. Treatment for ADHD for preschool children prescribe parent training in behavioral management, which is PTBM. For elementary and middle school, PTBM plus behavioral classroom interventions and stimulants, which are medications. For adolescents between 12 and 8 years, behavioral interventions to decrease interruptions, aggression, and school performance improvement. Medications for ADHD include Adderall, atypical antipsychotics, SSRIs, and adrenergic agonists. Side effects are headaches, abdominal pain, loss of appetite, and sleep problems. Autism spectrum disorder, ASD, should be screened at an early age to recognize abnormal behavioral pattern, delay in milestones, communication, social, and emotional issues. Depression is the most common mental health disorder affecting 1 in 8 adolescents and young adults each year. Assessment for adolescents who experience symptoms most of the day, every day, or at least 2 weeks in a year, they have major depression. If left untreated, there is a major risk of suicide. The screening tool starts with PHQ-2 and it can be followed by PHQ-9. Labs would include CBC, CMP, UA, urine for toxicology, and STD panel. Treatment usually includes antidepressants, SSRIs and SNRIs, physiotherapy, CBT, or both. Anxiety disorder is also another common condition, and screening tool for that is a Hamilton scale. Treatment includes behavioral therapy, CBT, antidepressants. So among adolescents, we have to monitor the side effects of medications for increased weight gain, suicidal ideation with SSRIs and SNRIs. Healthcare providers are also advised to screen 5 areas to identify any mental health issues among children and adolescents: depression, child maltreatment, alcohol use, substance use disorder, suicide risk. Referral to child psychiatrist is required for collaborative care. My next slide is about mental health disorders in a special population, LGBTQ. If you look at the epidemiology, LGBTQ adults are about 2.5 times more likely to experience depression, anxiety, and substance misuse disorder compared with their heterosexual individuals. According to CDC's 2015 Youth Risk Behavior Survey, about 60% of LGBT reported being extremely sad or hopeless and stopped some of their usual activities. They also have 4 times higher suicidal attempt rates compared to their heterosexual youth, and 13% of LGBTQ adults have mental illnesses. They may experience more serious symptoms compared to 4% of their heterosexual living with mental illness. In this slide, I am presenting other health risks that are associated with the mental health disorders in LGBTQ communities. These include use of illegal drugs, and they're also at a greater risk of suicide. HIV is another health issue that has a huge impact on the mental health of homosexual men. Rejection from family and close friends, some traumatic experience like bullying, labeling, denial of opportunities or access, physical, mental abuse, and they being the victim of hate crimes, substance use disorders. Transgenders are 4 times more likely to use substance use as compared to their cisgenders. Discrimination also contribute to higher risk of PTSD in LGBT community. Suicide rate is about 40% compared to 5% in general population. Inadequate mental health care, race, and economics. There are 2 major additional factors with fear of disclosing their sexual orientation and gender identity that can also lead to provider bias. Treatment for depression, anxiety includes psychotherapy and antidepressants. And LGBTQ inclusive therapists can also lead to some better outcomes and recovery. For PCP, it is important to screen LGBTQ population for depression, anxiety, bipolar disorders with non-judgmental and supportive attitude, and provide timely referrals to mental health care providers for addressing their mental health issues. We should also offer local community resources for adults and supportive environment at home and school to help LGBT communities to survive with optimal health outcomes. In this slide, I am focusing on mental health disorders in immigrant and migrant workers. The most common health disorders include depressive disorders, anxiety disorders, substance use disorders, psychotic disorders, suicidal risk, and PTSD. Social exclusion, discrimination, restrictions to access opportunities, language and cultural beliefs, blocks the ability to integrate in a new environment and negatively impacts mental health. Major mental health challenges include immigration, psychological, behavioral, and integrational conflicts, and barriers to mental health services. Immigrants are at risk for mental health problems that includes depression, anxiety, and particularly the PTSD because of their traumatic experiences. Assessment of PTSD symptoms as a clinician is important, and they include intrusive thoughts, re-experiencing and traumatic events, nightmares, flashbacks, emotional distress, avoidance symptoms, negative thoughts, and hyperarousal. Diagnostic DSM-5 criteria: symptoms must persist for more than 1 month, and they must cause clinically significant distress in social, occupational, and other functioning. Clinicians should consider, as you can see in this slide, I have focused on certain factors like lack of standardized translation of instruments, lack of normative standards and studies on reliability of the test scores with different immigrant groups, and failure to take culture into consideration that can lead to misdiagnosis. Pharmacological treatment for PTSD, it includes SSRIs, TCA for some patients, and anxiolytic medications for short course of therapy. Non-pharmacological treatment for PTSD includes psychotherapy, that is cognitive processing therapy, CPT, prolonged exposure therapy, PE, eye movement desensitization and reprocessing, which is EMDR, group therapy, relaxation therapy, and peer counseling. Clinicians should also refer these patients to psychiatrists and provide culturally competent, unbiased, and patient-preferred care. Thank you for watching my presentation. I have added some references in the end. I hope you enjoyed it. Have a wonderful day.